We are back here at Coastal Carolina Hospital on Healthy Living. We're talking to Dr. Gwynn, and we're talking about prostates. And we've been talking about some new treatment options that you all have here at Coastal Carolina Hospital. And I'm really curious just about the disorder or disease of the prostate that would be appropriate for aquablation, is what you were specifically talking about.
Mm-hmm. So prostate, as far as one of the most two common prostate diseases per se, are going to be enlarged prostate or benign prostatic hypertrophy, where it's growing, it's restricting the flow of urine, leading to I can't urinate, slow flow, or going urgently, frequently. These types of problems that are bothersome.
What is that a function of, and how would I know that I might have that? Obviously, slow flow of urine.
Well, you wouldn't have it because you're a female, but
thanks for asking, right?
But slower flow is one. As the prostate restricts, as it grows, I guess who would that be? It's basically the guy who has enlarged prostate. There may be a family history of it.
Okay, that was my question. Is that genetic? Is it environmental?
There generally can be a genetic component of it.
Age-related?
Age-related, you're certainly more at risk as you get, I think it's over 80% in octogenarians, so it's very common.
Very interesting. And how is it diagnosed, and at what point, if you have it, BPH, are interventions appropriate? And are there different levels of interventions? That was 9 questions rolled into.
That was a lot, and I guess I'll answer it like this. Normally, if a gentleman is having issues with urination, they may talk to their primary care doctor first. And say, I'm having this issue, and they'll say, well, would you like to try medicine to help you? And so they may start them on medicine, Flomax, most guys have heard of. There's some other medications. We then say, all right, is that getting better? If they're happy on it, that may be all they need. Generally, when someone gets referred to the urologist, they're not happy on medicine, or they're looking for a different solution. And so then when they come in, we see how well is that medication working? Would they be interested in a surgical therapy? And we talk about the different therapies we have to offer. Well,
and I guess I need to even ask a more basic question. And just because the flow of urination is slow or stop, start, doesn't necessarily mean it is BPH.
So a urinary flow that's stop and start, in general, if it's a guy, there's a chance it can be BPH. I mean, there's other potential diseases such as strictures of the urethra. So yeah, there can be other reasons, but 9 times out of 10, in an adult male who's having progressive symptoms, it's an enlarged prostate.
Once we have the treatment intervention, we have the aquablation, or whichever one you do, is that a permanent cure? Is it, how long does that last? And any side effects, what can they expect? What is the recovery time?
So aquablation has not been out as long as a TURP procedure. But I think we can base a lot of the long-term data on that for this. So I would think with most men who have aquablation, they're not going to require retreatment or I think prostate tissue, it's well known that you can regrow it with time. I think a lot of men who will regrow tissue after procedure, it's not clinically significant. So I think that's a long-winded answer of saying it should be good for the long haul.
With our demographic of where we are here in the Lowcountry, is this BPH one of the main things that you see within your practice?
I would say in a urology practice here, especially near retirement communities, that's very common.
Is there anything you can do to prevent that?
Well, I get asked that a lot, and I think you can't battle genetics.
That's true.
Healthy diets.
Let me guess.
More chicken, fish, vegetables. Those are going to be better for you.
Sleep, exercise.
So I think that's a lot of it. Sedentary lifestyle is not good. So we've got some correlations, but I think genetics a big one.
Well, it's funny that when we talk about that and we kind of go, genetics, sleep, all of that, but if we live a healthy lifestyle, we're less likely to have some of these things.
Absolutely, and prostate health is no different.
It is so easy to talk to you. I really appreciate your time, and thank you so much. Again, learned something wonderful. Thank you all for joining us here at Coastal Carolina Hospital on Healthy Living. Bye-bye.